Thank you for taking the time to learn about the Safe-Flo Saliva Ejector. It is a new saliva ejector with a built-in one-way valve that will stop contaminated fluid from backflowing into a patient's mouth. It is the simplest and lowest cost way of providing infection control for the low-volume saliva ejector. There are 5 key publications that define and communicate the issue of cross-contamination from the low-volume saliva ejector. These publications can be easily found on the Internet. The 3 research projects prove backflow occurs with an open or closed mouth, and if the saliva ejector is above the patient's mouth, the risk of cross-contamination increases significantly. In August of 2007, the Center for Disease Control published a report regarding patient-to-patient transmission of hepatitis B in a dental clinic. The incident involves a patient diagnosed with hepatitis B after undergoing surgery at the dental clinic. Molecular epidemiologic techniques indicated transmission of hepatitis B between the 2 patients. When investigators visited the dental clinic, they determined the clinic routinely followed standard infection control techniques. The actual source of the cross-contamination was not identified by the CDC. Since current infection control procedures do not involve flushing the vacuum lines between patients, the source of the cross-contamination may have been the saliva ejector. Some of the common viruses that are of concern when it comes to cross-contamination are listed in the chart. You can see viruses can live for many hours outside the body, and when they are in a moist environment, they can live even longer. The vacuum tubing in the dental office is certainly a moist environment, where it is possible for viruses to live for several days. As a result of the research, the ADA and the CDC warn dental practitioners of the risk of cross-contamination from the saliva ejector. They leave it up to the dental office practitioners to take the necessary action to minimize and manage the risk. Until now, there has not been a good, cost-effective solution to deal with backflow or suckback. Contrary to initial thought, backflow occurs with an open or closed mouth. According to the studies, even a large amount of water being sucked up may cause the fluids to drain back to the patient's mouth. This is new information for many practitioners. What you are watching is fluid that has been sucked out of a small disposable cup. Once all the fluid has been sucked out of the cup, air enters the system and flows past the fluid. As the valve is closed, you see the fluid run backwards until it gathers on top of the valve. When the valve is opened, the air bursts through the fluid and again spreads it against the walls of the tube. When the valve is closed, the fluid runs backward and collects on top of the valve. These are the flow dynamics that are occurring in the saliva ejector system, and they are the flow characteristics that set up the potential for cross-contamination. Fluids and tissue in close proximity to the patient's mouth are the main concern. If you look at the on-off switch, you can see the locations where fluids, tissue, and biofilm will collect. When the saliva ejector is removed, the contaminated materials remain. The next saliva ejector is pushed into the rubber boot, opening the pathway to the patient. Today, dental offices are using vacuum line cleaning chemicals to manage the risk. The chemicals clean out the vacuum line and minimize biofilm. They also keep the system working well, and they deodorize the holding tank. So the cleaners are an important part of the solution. However, the CDC and the manufacturers of the cleaning chemicals only recommend using the cleaners once per day. That means the first patient could get the cleaning chemicals in their mouth, and the rest of the patients are exposed to the contamination left behind by each new patient that visits the dental office that day. The Safe-Flo saliva ejector is a simple design that is used the same way as the current saliva ejectors. Simply push it into the on-off switch and it is ready to go. Each patient gets a new, fresh, clean, one-way valve to protect them from backflow. In this video, you can see the valve open and close as the vacuum switch is also open and closed. In this video, you will see fluid backflow to the valve. The valve will close as the air is blocked to prevent the fluid from getting to the end of the saliva ejector. The most significant benefit of the Safe-Flo Saliva Ejector is each patient gets a new one-way valve to protect them from backflow or suckback from the vacuum system. If the standard saliva ejector is used above the level of the patient's mouth, the probability of backflow goes up significantly, and backflow can occur when the mouth is open or closed. The Safe-Flo Saliva Ejector will protect each patient, regardless of how the ejector is used or positioned. The benefit of worry-free use of the Safe-Flo Saliva Ejector allows for more frequent use. The ejector can be used throughout the patient's mouth to minimize gagging and reduce swallowing. Therefore, it provides increased patient comfort and better quality of care. The grip makes the ejector easier to manipulate and to move oral tissue as needed to provide the best care and evacuate the entire mouth. As you saw in a previous slide, the CDC has reported patient-to-patient transmission of hepatitis in the dental office. Many other illnesses may be transmitted between patients and never identified by health investigators. Proper preparation of the vacuum system between patients involves flushing the high volume and saliva ejector tubing with a cleaning solution followed by a water rinse. The Safe-Flo Saliva Ejector is almost 50% the cost of flushing the tubing between patients. Not flushing the lines between patients or using a product like the Safe-Flo Saliva Ejector is ignoring the research and the CDC statement of risk of cross-contamination. Thank you for taking the time to learn about the Safe-Flo Saliva Ejector. It's one of the newest infection control products for the dental office.